Did you know that in the United States, 2.7 to 3.9 million people have chronic hepatitis C virus? Did you also know that HCV can be cured with antiviral medication in over 90% of people? HCV is a blood-brain virus that causes acute and chronic hepatitis. Today, the most common method of transmission is the sharing of needles and other equipment by IV drug users. A small percentage of those infected with acute HCV will clear the virus. However, 70 to 85% will develop chronic infection that may lead to liver cirrhosis or cancer. There is no vaccine for HCV, but new drugs have made it possible to cure most infections. Trends show that rates were highest in the early 1990s, followed by a drastic decline due to the initiation of regular blood screening. In recent years, they have begun to increase again. In 2010, surveillance data from the Massachusetts Department of Public Health showed that rising rates are occurring in a distinct population, which includes young male and female IV drug users of primarily white race, suburban or rural location, who began using prescription opioids before transitioning to heroin injection. Around 20 to 30% of IV drug users will contract HCV within 2 years of use, and more than 50% of people living with HCV in the U.S. acquired it through IV drug use. Trends show that recent rates are highest in those aged 20 to 29, followed by those aged 30 to 39. What can we do to prevent new infections? We need a better understanding of the risk factors, increased surveillance, increased access to peer mentoring behavioral intervention programs and counseling services, more needle exchange programs, and awareness of the virus. Prevalence of HCV is highest among those born between 1945 and 1965 before regular blood products were screened in 1992 or through IV drug use. Many people are infected with HCV and unaware of their positive status. To lower prevalence rates, we need education about the importance of getting tested for those at highest risk. We need to make treatment options more readily available and affordable, and we need early diagnosis of chronic infection. In conclusion, we need more funding for state surveillance systems, we need funding for treatment, and we need immediate attention given to the IV drug problem in the U.S., which is fostering new HCV infections.